Good evening, everyone, and welcome to the Cardiovascular Disease and Living with HIV webinar. I'm Destiny, the media strategist for Seeds of Healing. Seeds of Healing is an HIV awareness and advocacy organization whose mission is to deconstruct myths that perpetuate HIV stigma. Our work seeks to eliminate disparities for Black women. This webinar is being recorded and will be shared on our SOH Time platform and posted to our YouTube channel. If you do not wish to be recorded, you may excuse yourself, but the panelists will be the only ones on video. Attendees are able to drop questions in the chat box and they will be shared at the end of the webinar. Feel free to ask any questions or write any comments in the chat throughout the program. If you did not have a chance to do the pre-survey, I will drop it in the chat now for you to fill out really quickly. It's only 2 questions. And then today's webinar is a SOH Time event. SOH Time is a virtual platform for Black women living positively. And here's a little bit more about the platform from our 2 moderators.
Hey, ladies. Welcome to SOH Time. My name is Benita Spradley, one of the moderators and content contributors here, and we're excited to have you aboard.
Hello, Queens, and welcome to SOH Time. I'm Tamisha Isaac, also one of your moderators and content contributors. I'm honored to have you join us.
SOH Time is a platform for Black women to connect across the U.S. to provide tools for self-care and encourage consistent adherence.
SOH Time is a platform for us, created by us, to collaborate and center issues that affects Black women, the struggle causes by a diagnosis or chronic illness.
We have groups with specific topics to cater to the mission of SOH Time, but uplift, empower, and strengthen you as we power through on this journey.
Surrounding yourself with women that look like you in a safe space where you are free to be yourself while learning from each other and sharing resources that can enhance your way of life on the course of this journey.
We are here for each one of you. We welcome you and we look forward to networking, supporting one another, and learning new things as we come together on this SOH Time website.
Welcome.
A quick introduction to our speakers this evening. We have Dr. Shamika Martin, who recently started her family medicine residency in Wilmington, North Carolina. She chose family medicine because she wanted to be able to treat patients of all ages and build a professional relationship with all of her patients. Her interests in medicine include preventative medicine, women's health, and global health. We have Dr. Kouris, who received a medical degree in osteopathic medicine. Currently, Dr. Kouris also serves as a family medicine resident. He is passionate about fitness and nutrition and loves being outdoors. We have Dr. Mehta, who is a family medicine resident at Coastal Family Medicine in Wilmington, North Carolina. After traveling around the world for medical school, she naturally gravitated towards the small town familial feel of Coastal Family Medicine. And finally, we have Ms. Bonita Spradley, one of our very own SOH Time moderators. Bonita has been living with an HIV diagnosis for over 30 years. After her diagnosis, she became involved in many organizations doing work with HIV and AIDS prevention, as well as advocacy. And without further ado, I will turn it over to the residents.
All right. So one of the things that we wanted to talk about today was cardiovascular disease. And when we were talking about this topic, we were thinking about potential things to talk about today. We wanted to do something, maybe potentially a series where we could talk about maybe chronic management of different diseases and living with the diagnosis of HIV and what that looks like. So today we're going to be specifically talking about cardiovascular disease in terms of what it is exactly, how it kind of correlates or goes hand in hand with an HIV diagnosis, and then also just in terms of lifestyle, what we can do to kind of help us when we're living with those sorts of diseases. So if we can go to the next slide. So first, what is cardiovascular disease? It's a big fancy term. We don't really know what exactly it is, a lot of us. And in short, I will refer to it as CVD from here on out. So next slide. So just a simple definition of it. It's basically a disease that would affect our hearts and our blood vessels. It's an umbrella term for a lot of different diseases that you see listed here. But basically, it's just a big fancy word for saying that, it's disease of our heart and then our blood vessels. It can, depending on where that disease is located in terms of the blood vessels, affect different organs in our body. So for example, it can manifest itself as coronary heart disease, cerebrovascular disease, peripheral arterial disease, DVT, and then the list goes on. The ones that I want to focus on a little bit more today are the first three specifically, and potentially the first four, just in terms of, those are the most common ones that we see. And based on location, they manifest themselves in different ways, and they have different symptoms that we should be able to look out for. So if we can go to the next slide, I think, location is a big key. So the main differences between these different diseases is where they occur in the body. So for example, the first one on the list was coronary heart disease. Basically, it's a fancy term for saying that it's disease that is affecting our heart and the blood vessels that are feeding into the heart. Another one that was on the list was peripheral arterial disease. That's one where it's going to affect the blood vessels that are in our extremities. And that can also, cause different signs and symptoms as well. Another one that we have is thrombosis or deep vein thrombosis. It's becoming a little bit more well known, the disease, in terms of, if you're sitting on a long flight, and you can potentially get blood clots from that. And that's something, that we're becoming more and more aware of. And something that could be scary happening after that is those blood clots traveling through the body and potentially causing some damage to our lungs as well, in terms of having difficulty breathing too. Another thing that we look out for is stroke-like symptoms too, which is, what we were referring to as cerebrovascular disease in the other slide. If that disease affects the blood vessels in our brain, it can manifest as stroke symptoms. So those are the big ones, that we kind of look out for. And then in terms of location, something that's a little bit unfortunate about cardiovascular disease is the fact that, it can go unnoticed for a really long time. And a lot of the times it manifests itself as something really scary and something acute that happens all of a sudden. So if we can go to the next slide. So again, those acute things that I'm talking about, a lot of the times this disease goes unnoticed until something extreme as a heart attack or a stroke can happen. So, like I said before, a heart attack can happen if we're, if we're having that disease in our blood vessels that feed into our heart, and then we're getting all of these alarm symptoms all of a sudden. And same with the stroke. If we're having that disease in the blood vessels in our brain, then we can have, signs and symptoms of a stroke as well. So something to look out for when those are happening. So for example, the classic case that we see in a heart attack would be chest pain, sweating, that pain that's kind of going down the arm as well, the left-hand side of our body. Unfortunately, in women, it's a little bit of atypical presentation, what we like to call, just because you're not really getting that classic scenario with that chest pain going down the arm. A lot of the times what ends up happening is there's a presentation that's not really straightforward in women. They can get arm pain, they can get jaw pain, back pain, belly pain. It can manifest itself in a number of different ways. Some of the main signs and symptoms, that could present as a heart attack in women could be nausea, vomiting. And obviously, that's not something that's typical for that scenario. And I think because of that, it's causing a lot of different health disparities in women, and especially in women in color too, just because we're not really presenting a typical way that we would see. A heart attack is definitely a lot more common in the male population. However, of course, it still affects us females too. And just because we're not really presenting typically, we're not really getting the healthcare adequate healthcare, I would say, in terms of being able to be diagnosed properly, and then also being placed on medications in the future as well after a heart attack to prevent any sort of adverse effects from happening afterwards too. So definitely, you know, because of that atypical presentation, it does cause a lot of healthcare disparities in our population. Another really alarming thing that can happen from cardiovascular disease, or CVD, is stroke. I know the mnemonic has been changing a little bit over the years, but the most recent one that they are seeing, or they're using, is be fast. So you can see that in a lot of different healthcare environments. If you're ever walking around a hospital, you'll see these signs a lot. So the B stands for balance. Basically, you know, if you feel like you're unsteady on your feet, if you feel uncoordinated, that could be a sign or symptom of a stroke. In terms of your eyes, which is the E, you can have, you know, changes in your vision. All of a sudden, maybe one eye is just not functioning the way that it should be. You can have blurry vision as well. You can have eyelid drooping as well. And I didn't mention before, but a lot of the symptoms with stroke happens because of, you know, this one side presentation. So a lot of these symptoms are happening only on one side of the body. So the F stands for face. You can see a lot of facial drooping as well. So, you know, in these patients, you know, if you feel like you're suspecting somebody having a stroke, oftentimes you ask them to smile just to see if you're seeing any sort of asymmetry in their facial expression. The next one is arm. So, you know, if you feel like one side of the body is just going numb, it's not really functioning as well as it should be. If you feel like your strength is off, you're dropping objects all of a sudden in one arm, that could be also a potential sign or symptom. The S, which is next, stands for speech. So if you feel like you're slurring your speech, that could also occur as well. And then T is for time. So basically what that means is if you're seeing any of these symptoms, the B, E, F, A, or S, then T is it is time to call 911. It is time for them to, you know, go to the emergency room just to get further workup. So next slide, please. Okay. So, you know, like I mentioned before, it is really difficult and unfortunate with cardiovascular disease that it doesn't really present itself unless, you know, there are these scary symptoms and scary disease processes that happen. So then what can we do in the meantime in order to prevent something scary like that from happening? So there are, you know, certain things that we look for in our patient populations, and certain things that we ask you to look for as well and be aware of as we're going through that process. And especially as family physicians, being able to follow our patients for a longer period of times, it's something that we routinely look for as well. So something to look out for is high blood pressure. Another thing is if you're having high blood sugars consistently, high cholesterol, if you feel like all of a sudden, you know, you're having this weight gain, or if you're having trouble with obesity, those are definitely risk factors that we look for. And with a lot of these things, you know, they're pretty, in terms of metrics, they're pretty easy to measure. So a lot of people, you know, are aware of the normal blood pressure, or with blood sugar, you know, it can be high, it can be low. There's a certain range that we look for. In terms of weight gain, you know, we look over that through a linear process over time. One of the ones that can be a little bit more confusing, especially for patients, is being able to interpret the blood tests for cholesterol, because there are, you know, a few different types of cholesterol. We order something called a lipid panel, which, you know, can also be a little bit intimidating at first when you're not really understanding what exactly that means. So, you know, something that I wanted to talk about today is explaining that, and explaining, you know, if you are getting that result, what exactly does that result mean? So next slide, please. Yeah. So these are some of the things that routinely come up on a lipid panel. And when I say lipid, it's basically just a fancy way of saying fat. So we have different types of fats that we consume and that we make in our body. And not all fats are bad fats. You know, I think that there is definitely that misnomer that, you know, comes with fat, but a lot of the fat that we need in our bodies is actually essential for our function. So, you know, a few things, the main things that we look out for, first that you see listed there is total cholesterol. So, we've all heard of the term good cholesterol, bad cholesterol. And, there are different types as well. And mostly that comes from what we consume from our diet. Another thing that we see in the diet and what we can get from our diet is the last one on the list, which is triglycerides. Both of these are basically things that we consume, and they have different functions in our body. So we do need, some amount of them in order to function. For example, cholesterol, we use that to make different hormones in our body. Triglycerides, we use that for energy in our body. So we definitely need some amount of those. But we do say, that the lower the better in terms of the values that we are looking for in that panel. Next we have the HDL versus the LDL. And, when we hear good cholesterol versus bad cholesterol, that's typically what we're referring to. So HDL is, named the good cholesterol, and I think H for happy. LDL would be our bad cholesterol. So obviously, with that HDL, because it is the good cholesterol, we want it to be a little bit higher. LDL is the bad one, so we'd like it to be a little bit lower. And I'll explain, on the next slide, what exactly that means by good cholesterol and bad cholesterol. So if you can go to the next slide for me. Yeah. So I know we're kind of going into the weeds a little bit, but I'm hoping that, this graphic can simplify it a little bit more in terms of what I mean by those different values that we're looking for on that lipid panel. So as you see, think of the last time that you had like a cheeseburger, a nice fatty steak or something like that. We are consuming those triglycerides, consuming that cholesterol, and we intake that. Our body digests it, and we break it down into the fats that we need that are vital for us to survive. So those fats, in terms of triglycerides and cholesterol, they travel through our blood vessels. When they travel through our blood vessels, they go through this conversion process. Their ultimate goal is to travel to the liver in order for them to get processed in our body. And that's where the HDL and the LDL comes into play. So the HDL will actually transport all of the fats into the liver to get processed. And that's why it's called the good cholesterol, because it helps us eliminate those fats from our body. The LDL, in function, actually is a really good thing, and it's vital for what we need, because it transports those fats to the cells in order for us to get energy, in order for us to make hormones in our body. The problem with that, however, comes when we have too much of it. So think about, if you're having a lot of cholesterol in your cells already, it's going to take a little bit for your body to send a signal saying, hey, I have enough, I don't want any more, we're done. And so that's kind of where the issue comes in, because the LDL will keep traveling through the blood vessel, and they won't really get that signal to stop after a certain point. And because of that, they start building up in our blood vessels, and that's what we call plaques. So those plaques, or those clogged arteries, which is something, that we commonly refer to them as, is what leads to the diseases that we're talking about today. So if we can go to the next slide. Yeah, so just like I talked about, in terms of the disease and the different blood vessels that we see, what I mean by the disease is there are certain plaque buildup in those blood vessels. And what happens with the plaque buildup is, as you can see in the image in B, is it's narrowing that artery. So we're not really getting as much blood flow to the organs that we need. And if we're not getting that blood flow to, major organs in our body, like the heart or the brain, those cells can die. And then that's where we get those, really worrisome, really scary symptoms like a heart attack or a stroke. And that's something, that we want to talk to you about today. That's kind of the intro to what we're talking about today in terms of cardiovascular disease. I know that was, a little bit into the details of things. So if you guys have any questions, please feel free to ask. If not, I can turn it over to Dr. Martin, and she can kind of continue our talk for today.
Sure. Thanks, Dr. Mehta. So, Destiny, you can just go to the next slide. Thank you. So, cardiovascular disease is actually a major cause of morbidity and mortality in people with HIV. And about 11% of deaths among people with HIV can be attributed to cardiovascular disease. So I wanted to start off with a couple statistics for you guys, just to get you thinking. So people living with HIV have up to a 2 times greater risk of cardiovascular disease than people not living with HIV. And we're starting to see a cardiovascular disease earlier in people with HIV than their HIV negative counterparts. So what does that mean? When you think of a heart attack, what age do you assume somebody is? And just kind of ponder upon it, yeah. But the average age for a heart attack in someone without HIV is about 65 to 70 years old, versus someone with HIV, the average age is about 50. Right. And then also, women living with HIV also have a 2 times greater risk than males who live with HIV. And I'll kind of get into that a little bit later as well. And then lastly, being on antiretroviral therapy can slightly increase your risk of cardiovascular disease. And I'll also get into that a little bit later as well. You can go to the next slide. All right, so in this chart, it basically just says, before antiretroviral medications, HIV commonly progressed to AIDS, and then life expectancy was only until about age 40 to 50 years old. So we weren't really seeing a lot of cardiovascular complications. But in the 1990s, that's when antiretroviral therapies became a little bit more prevalent. And so we were able to achieve more viral suppression, and that actually led to an increased life expectancy. So now we're seeing people live up into their 70s and 80s. And so also with that though, we're kind of seeing more cardiovascular complications. And so researchers initially thought that maybe the antiretroviral therapies were having more of an effect on your cardiovascular system. But what we realized is that because the life expectancy has increased, we're just kind of seeing more of these long-term effects that HIV has. And so HIV has turned from what used to be a terminal illness to now a chronic condition that is manageable with therapy. You can go to the next slide. And so the 3 main factors that researchers thought played a huge factor in cardiovascular disease in people with HIV were, 1, these traditional risk factors. So smoking, substance use, or even having chronic conditions like hypertension, high cholesterol, and diabetes. But also, we realized that HIV itself is playing a factor, and it's been known to depress your immune system. But at the same time, it stimulates a lot of inflammatory pathways in your body, even when it's well controlled on antiretroviral therapies. So for specifics, the specific mechanism is still slightly unknown, but researchers believe that there's this inflammatory signal that is occurring that they have seen also in cardiovascular disease. And so they think that this might be the connection. So even patients who are on antiretroviral therapies, you won't see this viral replication, but you're gonna see this inflammation that your body has. And so to kind of simplify it, imagine that you get a splinter in your finger. Your body is going to launch multiple attacks with your cells and different chemicals in your body. Why? Because the splinter is foreign to your body. And so your body knows it's not supposed to be there. And so our finger is going to turn red. Maybe you'll have a little bit of swelling, and maybe you'll feel this throbbing pain as well. And all this is occurring because your body's trying to get rid of this splinter. And so this is what we call an inflammatory process. Now think of it in terms of HIV. It's also a virus that's foreign to your body. And so your body is going to respond by sending out all these inflammatory signals to kind of contain it. And so even when you're on antiretroviral therapies and your virus is suppressed, your immune system is still working hard in order to keep it suppressed. And then the antiretroviral therapies itself, again, these medications have long-term effects, and we're still unsure about these long-term effects because, again, it's only become more prevalent in the 1990s. And so now we're seeing these long-term effects as well. And I'll get into that a little bit more. But there's also other factors that are playing a huge part in it as well. And Destiny, you can just keep double clicking until you see a question mark. So, opportunistic infections. So people who are not on antiretroviral therapies, their immune system is going to be depressed. And so you are at an increased risk of multiple infections. And again, these infections cause your body to respond. And so you're going to have more of an inflammatory process. And for females, women with HIV are at an increased risk because supposedly women have a higher level of immune activation and inflammation just in general. And we kind of think it's linked to our sex hormone production of estrogen. And so even after menopause, women in general, with or without HIV, have an increased risk of cardiovascular disease and these other traditional risk factors compared to men. And for psychosocial factors like anxiety and depression, they can definitely take a toll on your body as well. And genetics. Having a family history of cardiovascular disease already puts you at a higher risk than someone without a family history. And then there's still these unknown factors out there. Research is continuous. There's always going to be research. And so we're still finding things out year by year. Go to the next slide. So again, antiretroviral therapies only became really prevalent in the 1990s and has since been continuously evolving. In the whole world, there's about 37 million people living with HIV, but only about 46 of them, which comes up to about 17 million people, are on antiretroviral therapies. And these regimens can include up to 3 or 4 medications, or even like a combination of these medications into one pill. And if you look at this chart, you can definitely see that there's some effects that these medications have on your cholesterol. And the effects may differ between the different classes, but also between the drugs within the same class. So if you look at the protease inhibitors, you can see that some drugs do affect your lipids. Some can affect the good cholesterol, and some can affect the bad cholesterol. But at the same time, there are some that have no effect on your cholesterol whatsoever. And so when we think of these regimens, if you're on 3 medications that can affect your cholesterol, you're definitely at an increased risk than someone who's on maybe a combination drug of a bunch of neutral medications. This graph by no means has every single antiretroviral therapy that's out there. There's definitely more that's not included on this table, but just be aware that these drugs do have an effect on your cholesterol, and your doctors are more worried about suppressing the virus than these side effects. And so, it's also up to our patients to kind of be aware of this as well, especially if you know that you're at an increased risk of cardiovascular disease. Next slide. Thank you. And so I kind of just wanted to show a visual representation of some of the cardiovascular diseases that we see in people with HIV. And this graph basically shows people with HIV who are not on antiretroviral therapies. So we're seeing a lot of HIV-related cardiomyopathy and pericarditis. And I would categorize this as more of like heart complications. But with people on antiretroviral therapies, we're seeing more of these other groups like hypertension, coronary artery disease, and even this other category. And so we're seeing the complications kind of shift from cardiac to more of like your blood vessels, and it's affecting your blood vessels more. Go to the next one. Great. So my colleague, Dr. Kouris, will get into more about how to address those risk factors, but if you guys don't have any questions specifically for me, then.
I will save them till the end.
Okay.
Yeah, thank you so much, both
No
of you.
problem.
Hey everyone, it's a pleasure to be here. I'm Dr. Kouris, and I'm going to be speaking to you about decreasing your risk of cardiovascular disease. Next slide. So, big thing is physical activity. Next slide. So, physical activity, some of the benefits that come along with this is improved mood and sleep, increased focus and energy, decreased stress and inflammation, and we just spoke about how HIV can cause inflammation in the body, and decreased risk for cardiovascular disease, diabetes, and high blood pressure. Next slide. So what are the recommendations? According to the American Heart Association, or the AHA, they say about 150 to 300 minutes of mixed, mild, and moderate intensity. If you've never really worked out before, you might be asking, how can I judge mild and moderate intensity? So what is intensity? It's how hard you go at your physical activity, be it sports or running or weightlifting. A good judge of intensity is if it's mild, you can breathe easily and can hold a conversation. So you can walk and talk. Moderate, you're upping it up a little bit. You can focus on your music or your podcast if you have your earbuds in, but you can't really have a conversation. And intense, or I like to say all out, you're really only able to focus on your breathing. Next slide. So I know a lot of us do live very busy lives, and it's very hard to get physical activity in. So one of the ways I try to look for every opportunity to get more steps in. And this does not require a gym to do. So any moment in your schedule that you can fit some walking into, it's always a benefit. Every step matters. I like to schedule time to go walk with friends and family. Great bonding and extra steps. When going shopping, always try and park farther away from the entrance of the shopping center. So again, you're just increasing that distance. This is just doing passive actions to increase your physical activity. Take the stairs, not the elevators. I know everyone's heard this one before, but stairs are an extremely good way of getting short bursts of physical activity in. And if you work in a hospital like myself, you'll randomly just find me going up and down stairs. It's just that extra little time in to get as many steps and burn as many calories as possible. So walk and talk. If you're going to call someone on your phone and you're going to be chatting away for 30, 40 minutes, sometimes an hour, go outside and walk and talk. And of course, if you're ever interested, audiobooks, podcasts, put them on, go for a stroll. Next slide. So now let's say we focus a little bit more towards gym. So here I have some gym equipment. On the left is the elliptical, center is the bicycle, and the third is the treadmill. The reason I picked these three pieces of equipment is because this is the best bang for your buck. And I've tried it, I've tested it after many years. Elliptical especially, these three are very good at upping intensity while having minimum impact on joints. I know a lot of people, a lot of the reasons they try and stay away from physical activity is that their joints hurt. I've tried to narrow it down at least to these three pieces of equipment, especially where you can find in, let's say, community recreation centers, to help you get the best bang for your buck as you increase the intensity on these machines. Next slide. So we went from figuring out how to train the heart, get the heart healthy. Now let's go to the other muscles, the vanity muscles. So strength training. What are some of the benefits of strength training? It's a higher resting metabolic rate. So this means when you're not doing anything and you're just sitting down, your body effectively burns more calories because you have more muscle on you, and your body requires, in order to maintain that muscle mass, to burn calories passively. That's one of the biggest benefits. And the more muscle you have, the higher your resting metabolic rate will be. So an increase in HDL. We went over HDL as the good HDL. Exercise actually is one of the only methods of increasing HDL. And HDL helps in turn, like Dr. Mehta was saying, take cholesterol from the bloodstream and bring it to the liver. So increasing HDL, always very important to clearing the cholesterol from your blood vessels. It also decreases triglycerides. It improves your blood sugar levels. It improves it and also helps maintain a more level blood sugar concentration in your blood. And also more support on your joints and decreased rate of bone thinning. And especially for women, as they age, they tend to have, a lot of women tend to have osteoporosis, and it accelerates after menopause. So when you strength train, when you are lifting weights or even body weight exercises, you're decreasing the rate at which bone thinning occurs. So you're preventing, or you're slowing down the rate of osteoporosis. Next slide. So where do we start? I know physical activity or exercising, weightlifting can be a little bit intimidating to people. So I'd like to encourage that you don't have to go crazy right off the bat. Start slow and build up. I recommend 2 days per week. You're going to start slow and build yourself up. And what I mean by this is you don't have to start with weights immediately. You can start just doing body exercises, using body weight, going from body weights to resistance bands, and then to weight. And eventually that becomes easy. And rather than 2 times per week, you up it to 3 or even 4 times a week. Hopefully we have the time to do 3 to 4 times a week. Compound exercises are the best. I stress this because, again, best bang for your buck. I want to make your exercising as time efficient as possible while burning the most calories as possible. Next slide. So here I have just a few, it's a simple image, just a few exercises that can be done at the gym or even at your home. So here we have the squats, jumping jacks, planks, lunges, push-ups, crunches, side planks, and air jump rope, all which I think are very good foundational exercises to help you build up to getting yourself more involved with heavier weights. And I would challenge you to do a small little exercise, 10 push-ups, 10 air squats, and 10 jumping jacks. Do that 3 times. And then the next day, see how you feel and analyze, oh, I could do more, or maybe I went a little too much and maybe I need to take it down. If you ever have questions on how to, maybe what's the proper technique for these exercises, you can always go to YouTube, type in squats or air squats or alternatives to squats to help get an idea of which exercise you can do at your level. Next slide. So some just general tips. So again, slow and steady, start with body weights, move up to resistance bands, and then finally start hitting the weights. You want to feel sore. Sore is a good indicator that you have worked your muscles out. Now, there is a perfect medium to this. If you feel sore for less than a day, you probably didn't push yourself hard enough. If you're feeling sore for more than 2 days, you probably went a little too hard, and next exercise, you should take it back down a little bit. The sweet spot, 1 to 2 days. That's how you know you are pushing your muscles to a good degree, and you're giving them time to properly recover before your next exercise. The goal is to not make you feel terrible, it's to make you feel good. Good form will prevent injury. And again, if you're ever curious about how to go about certain exercises, feel free to just type in push-up or push-up alternatives in YouTube, get a good idea of how to do these properly. Sleep is crucial. A lot of people do not get enough sleep. I always tell my patients, you have to aim for 8 hours. It allows for good mental recovery and good muscle growth. And of course, having fun. Sometimes it gets boring going to the gym all the time. I know, I do it all the time, and some days I'm really bored. So, I mean, I've never been to a Zumba class as I'm too uncoordinated for that, but Zumba is a lot of fun and I see a lot of people enjoying it. HIIT classes, which is high intensity interval training, and of course, sports. Get some of your friends together and join a team, make a team, and play against each other. It's a good way of mixing it up. Next slide. So now we're going to cover nutrition. Next slide. Along with exercise, nutrition, bar none, most important. So why does proper nutrition matter? It's important in maintaining your strength, your muscle mass. You need proper nutrition for that. Overall increased energy, improved focus and cognition, strong immune system, and overall, and most importantly, improved quality of life. Next slide. So some of the big nutrients, the big 3 are on the left: carbohydrates, proteins, and fats. And you also have vitamins, minerals, and water. So for carbohydrates, usually you want to aim for about 45 to 55% of your total caloric intake. Protein, you want to aim for about 30 to 35%. And fats, you want to aim for about 15 to 20%. A lot of us actually do not get enough protein in our diet. And protein is extremely important because protein satiates you, and you're able to stay fuller for a longer period of time. Next slide. So what are calories? So according to I believe the FDA, the average caloric intake should be about 2,000 calories. That's going to vary for everyone depending on muscle mass. So there's no hard way of saying, oh, you need to take in 2,000 calories. I don't really know where they got that number from. The best way to go about this is you have to get on a scale every day and start monitoring how your weight is fluctuating throughout the week. And the best way to do this is by making sure you're documenting your caloric intake. So a general rule of thumb for calories in, if calories in is greater than calories out, you're going to gain weight. You're not burning that energy off, that fuel for your body's going to store it as fat. If your calories in equals your calories out, your body weight really isn't going to change that much. And for some folks, that's perfectly fine. They're very happy at that weight. And if calories in is less than calories out, you're going to have weight loss. A lot of us have different goals. Some of our goals are weight loss. And to go about that, we'll look at calories in. Calories in is eating. How do we reduce eating? Well, we need to eat low calorie, high volume foods. Some of us actually struggle with gaining weight. The best way to gain weight, again, strength training and getting a proper protein diet. Next slide. So some quick tips on just overall nutritional tips. So increase your lean proteins, chicken breast, lean beefs, usually like 90% lean. I know it's not the most tasteful sometimes, but 90% lean, 10% fat, vegetables. And I cannot stress this enough. It's not just that, yes, vegetables are good for you, but vegetables, not only do they have fiber and all the minerals and vitamins you need, it keeps you fuller for a longer period of time while being low calorie dense. Beans are a great form of carbohydrates and proteins without any fat in them. I highly encourage people to go to their supermarkets, look for some canned beans. I get refried beans because they taste delicious. And for the calories, they are amazing. Lots of water. I cannot stress how important it is to get proper water intake in. If you're curious about how much water you need to be drinking, take your body weight, I believe, divide it by 2, and that's how many fluid ounces you need to be drinking per day. Diet soda and seltzer. If you like soda and sweet tea, even Gatorade, all of these are very high in calories, and it is very easy to drink your calories. You need to be very careful with that. Diet soda and flavored seltzer, they are great ways of cutting those calories out immediately. Be careful with fats. A lot of advertisement goes on saying how carbohydrates are bad for you and fats are bad for you. No, they're not. Fats are extremely important. We spoke about how fats are needed to actually make hormones in your body, but they're very energy dense, so you want to be careful with them. A good example of this is using oil sprays for your cooking. I've started to use it. It helps me reduce how much oil I put into a pan. A very nice way of just cutting some calories out. Read nutrition labels. I want you to get very comfortable with looking at nutrition labels, seeing the breakdown for proteins, carbohydrates, and fats. And most importantly, look at the serving sizes. Get used to looking at volume. How much of this can I eat? And what does that turn into calories? You want to be aiming for high volume, low calorie. And I'll end it on the popcorn. So popcorn is great because it's very low calories. Publix has great a popcorn. It's 35 calories per serving. It's 5 servings, so it comes out to like 150 calories. That'll take you like 30 or 40 minutes to eat. By the time you're done eating one bag of popcorn, you are done. And it's a great way to kill any little urges to go eat other sweets. And that's it. And if you have any questions for me, I'm happy to take them.
Let me just say thank you very kindly, Dr. Kouris, Dr. Mehta, and Dr. Martin. I really appreciate the tons of information that you guys provided this evening. 2 questions. I had a host of them, but you guys did so well and answered most of them. But what can you do to, like, I know you talked about exercise and eating well, but is there anything to flush the arteries? Like if you have a buildup, like is there a detox or like I drink alkaline water. Do any of those like flush, your arteries? Like if you have a buildup?
So I don't have any specific detox method in mind, but let's say you make a vegetable smoothie, right?
Okay.
In and of itself, it is a detox. You have all those minerals and vitamins that your body uses to help, let's say, how should I put this? Your body will use those minerals and vitamins to help clear your system, especially like your liver, to help function better and to clear any toxins out.
Great, sounds good. Now I know the whole plant-based craze, is on the scene now. So what do you recommend? Because I know plant-based means you've cut out meats, which typically have a lot of protein in it. Any words of wisdom in that switch from just eating regularly to maybe becoming vegan or, the whole plant-based diet?
Sure. So I always try and make this distinction. No diet is better than any other one. I've tried them all. And I can tell you right now, I have done diets where I've only eaten meat, and I've done diets where I've only eaten vegetables. A well-balanced diet is the best. But if for lifestyle reasons you prefer a vegan diet, again, just because it's vegan does not mean it's healthy. You need to really look at those nutrition labels and see, hey, are they putting in extra fats, which they do a lot, and then they trick you with their nice packaging. And is the volume I'm going to eat worth these calories, right? If you, for example, took a Snickers bar is probably like, I don't know, like 200 calories. That's 3 apples. I've never seen anyone sit down in front of me and eat 3 apples. And I can guarantee you by the time you're done eating 2, you'll be full.
Yeah.
And you have eaten half those calories and you'll be fuller for, I don't know, an hour longer. That's how I want you to think of nutrition. And in court, let's say vegan or plant-based, beans are probably one of your best forms of protein at that point. And I really stress, I feel like beans get left out a lot. They are very good, low fat, high protein, high carbohydrate meal to incorporate.
Thank you so much. And one final question does being on high blood medication or high cholesterol lower your chances of having CVD? And what would you say to that? Because I know some people, including myself, may be on 1 or 2 of the medications I mentioned, and it does not give you the rights to just eat any way you please just because you're on these medications. So any wisdom to that?
Yeah, so James, do you want to take this?
Yeah, please. Yep.
Yeah, and I know I'm noticing, the question kind of in the comment box as well. So I'll speak to, when to take the medications and, are they considered safe? So a lot of the time, we do have the blood pressure medications and the cholesterol lowering medications that, we do put patients on. However, they're not really our first line recommendations. Our first line recommendations is, what Dr. Kouris is talking about with those lifestyle modifications. A lot of the times, we see in patients that once they kind of, have those different types of lifestyle changes, it can really change their outcomes drastically. When we do use those medications, it's when, patients do need a little bit of extra help. They're saying, it's just not really time feasible for me right now, or just in terms of cost, it's, not as feasible for me to be thinking about this so much. And so that is when, those medications come into play. And I think those medications, yes, they do help, gratefully so. We do see a lot lower risk in terms of keeping blood pressure under control, and also keeping our cholesterol levels under control. That being said, I don't think that they're the fix-all that we would hope for them to be. Unfortunately, especially with cardiovascular disease, a lot of the times what ends up happening is once we have that plaque buildup, it's really hard to reverse that. We were kind of commenting on, is there a detox that you can do? Not really. Unfortunately, once that plaque buildup is there, all we can really do is try to help, decrease that rate of having it get worse, and having us kind of have those adverse effects like we talked about before. So we do have certain measures that we can take, and they are safe. I think the comment that was made was, sometimes I have heard that they can be bad for you. With any medication, there can be some, bad interactions or some adverse effects that we look out for. So that is, something to discuss with your doctor, is do those risks, or the benefits, do they outweigh the risk of taking those medications? And that's something that we routinely look out for too when we put people on those medications. So basically a long-winded explanation for saying, we do have medications, they do help, but I think more so we do recommend kind of having an overall sort of change in lifestyle, to help, especially, with women with HIV, who are kind of at an increased risk for developing cardiovascular disease.
Thank you so much. And I know I said that was my last question, but something came up and I want to ask, is there like a test? And instead of just waiting for those signs to show up, is there some test that you can take to find out if there's plaque buildup, or screening that you can, request when you go into your doctor to find out if you have any of this buildup in your system, in your arteries?
So, some of the blood tests that we talked about before, those are definitely things we monitor throughout. Other things, that look specifically at, the amount of blockage in your arteries, they can be a little bit more invasive, and a little bit more costly as well. Even, if you're looking to say an ultrasound for the legs to see if there's any sort of evidence of clots in the legs. If you're looking at the ultrasound of the neck to see if there's any sort of blockage in the vessels in the neck. So they're definitely out there. But again, they're a little bit more invasive, a little bit more costly. So it's something that we don't routinely do unless patients are seeing those, if they're high risk, or unless they're having those symptoms.
Okay, so we just have to rely on I think it was the HDL and the LDL.
Yeah, so we have the lipid panel, also a risk factor would be high blood sugar. So keeping a monitor of those, blood pressures, keeping those under control as well. Those are also some good signs and symptoms to kind of monitor.
Great, thank you so kindly. I really appreciate the information that you guys provided this evening. Thank you so much.
Thank you. Thank you so much for having us.
Yes, thank you for having us.
Thank you so much.
I'm going to drop a post survey into the chat for anyone to complete for us. Thank you everyone for attending the Cardiovascular Disease and Living with HIV webinar this evening. Thank you, Dr. Martin, Dr. Kouris, and Dr. Mehta, as well as Bonita, for your time and dedication. We encourage everyone to sign up for SOH Time and follow us on Facebook and Instagram for updates on upcoming webinars. Thank you again and have a lovely holiday season.